President saying that he won New Hampshire because it's a drug den wasn't actually well received by the governor or the people of that state. And that's another thing that came out in these transcripts. What do you make of that?
And what the president is saying is that this is a crisis. He's been to New Hampshire before saying it's a crisis of epidemic proportions, and he's absolutely right. You know, with opioids, something I work on here at the White House every single day, Chris, it's part of why I'm here, frankly. No state has been spared and no demographic group has been untouched. I'm sure you saw this in New Hampshire. And the president recognizes it's an epidemic that we have to try to solve. Talk about a nonpartisan issue in search of bipartisan solutions. I hope we can do that. And very recently, Secretary of Health and Human Services Tom Price and I traveled to New Hampshire together. We met with Governor Sununu. We've met here with the two senators from New Hampshire, both Democrats. They came here to the White House to have a meeting where Governor Christie, who heads up the bipartisan commission, and I were. We feel like this is an area where we can all work together. We have to cut down on the supply and cut down on the demand. There has to be interdiction, prevention, treatment, and recovery. And I will tell you, as someone who's had these grieving families cry on my shoulder, I love the fact that we are learning from them. They're so courageous, and they've suffered so grievously. I can't even relate. But we are learning from them how to avoid this for other families in the future. We're talking to first responders. I went to the Manchester Fire Department in New Hampshire and saw the amazing model that they have there, where they tell us you have other fire stations and other first responders coming from around the country trying to learn those best practices.
They're doing God's work out there, but they're understaffed and they're under-resourced, and they're still waiting for help.
We've met with the healthcare professionals, we've met with the faith-based employees, and we've met with those in treatment and recovery. And that Senate bill, where no Democrats would even come to the table to talk about the Senate bill, had $45 billion for opioids, in addition to the SAMHSA grants that have been distributed, in addition to the private grants that people apply for. I mean, so much can be done on the opioid crisis, but a lot of people are going to have to take off their partisan gear to get this done. We've heard from governors, 25 governors, lieutenant governors, state health commissioners, and you know what they tell us, Chris? They say that a couple of things are going on. You've got a restriction on the number of beds, after which you can get Medicaid reimbursement. We're working on that piece of the regulation. They also tell us that in many of the medical schools, the curriculum does not include over-prescribing. In other words, how to prescribe. And so making sure that our very smart physicians and pharmacists who are being trained in many different arenas also understand the dangers
medicine cabinet
of
becomes the first drug dealer for a lot of kids in this instance.
It does.
The criminalization of addiction is a problem.
Well, the fentanyl, the carfentanyl coming in.
The resources for treatment and the access and the parity within insurance, they're all real issues. We're studying them very closely. Again, I don't know anybody else who's coming out with a documentary like the one that this news organization is doing.
I very much look forward to seeing it. I thank you for the time tonight to talk about it, because
you are
it's just
always
roiling
welcome
our
to talk
nation.
about what matters.